Hey class, in the previous video, we have introduced the definition of the B-pen syndrome. In this video, we are going to study the etiology as well as the management. When thinking about the etiology, we have to think in two aspects, but also the theory from yin and yang. We always think in two. The exogenous pathogens as well as the antipathogenic qi. So one is from the enemy of the pathogens, one is from your army, the antipathogenic qi. As we mentioned in the last video, in the previous video, that's the causes of the big syndrome. It can be the wind, the dampness, the coldness, and the heat. So now, the etiology, we're going to focus on the wind, the heat, the dampness, and coldness. But no matter what are the causes, the result is the pain. Different kinds of pain. Why the patient will present as pain? Obstruction or blockage. Obstruction of qi and blood. When you see the obstruction of qi and blood, you need to think from this way backwards. So that's what you see from the clinic, from the patient. What can cause the obstruction of qi and blood? These are the possible causes. But where do these causes come from? The wind, the dampness, such as sweating in a windy environment, sitting or sleeping in a humid environment, working in the rain or in the water, such as someone work in the supermarket, in the cold air region, such as in the food region, or someone work in the farm, like someone work in the ocean. Pathogenic heat. So these are the possible causes. Sometimes you can ask the patient will present as these kinds of history in a windy environment. In some situations, these causes also can be confirmed by the symptoms. So the patient will tell you when the weather changes, they feel worse, the pain increase. In a very typical symptom, that the patient will tell you that they can feel worse a few days before the weather changes. It's very similar to the weather forecast. So the pain becomes worse for a few days, and then after a few days, the weather changes. So that's why we said due to the wind or the humid environment, the weather changes is not changing from rainy day to a sunny day. Mostly it's from a sunny day to a windy or raining day. So that's where in the nature, the wind and the humid increase will result in the pain, the increase of the pain in the patient. The syndrome differentiation, the main manifestations, so all patients must present as pain, either in joints or muscles. So in Chinese medicine, in acupuncture, we don't differentiate the pain in the joints or muscles. We call them B-pain syndrome. The treatment, the reason for this is because the treatment for acupuncture will be the same. We focus on unblocking the qi and blood circulation. So no matter in the joints or in the muscles. The patient may present as limitation of movement, may or may not. There are some subcategories of B-pain syndrome. The wind B, the painful B or Tong B, the Tong B. Tong is the Chinese name, the Mandarin. Tong means painful, so painful B. Wandering B. Wandering means something moving. Why we say the wind B? Because the characteristic of wind is something moving. So when we study the basic theory, we say one of the characteristics of wind is moving. So this patient they may present as pain in different locations, but what's most important in this category is the pain will move. So this patient may tell you that today they feel the pain in the wrist, in the right wrist. The second day, the pain moved to the knee. The wrist that doesn't feel pain. And after a few days, the pain moved to the other ankle. It can be either area. So for wind bee or wandering bee, actually from the tone, you already understand that this pain is moving. It will move here and there due to wind. The patient may present a thin white coating, floating slow pulse. The painful bee, the pain bee due to cold. That's why it also said cold bee. One of the characteristics of coldness is pain. Severe pain in the joints, fixed location, aggravated in cold environments. And now sometimes if we ask fixed location is not blasthasis. The cold sometimes also be accompanied by blasthasis because these two. You see from the study we separate them. It seems that there's a very clear line between wandering bee, and the cold bee or the blasthasis. But in clinical practice, when we see patients, sometimes it's actually the combination of these syndromes. But what's important from the study is we need to identify specific category. We need to identify the key manifestation. For painful bee, the most important is severe pain. The painful bee is due to coldness, so it can be alleviated in warm environments. So when you apply heat, the patient may feel better. The patient will present as a limitation of movements. That's one of the characteristics of coldness, the constriction. The cold sensation is also coldness, pale tongue. It must be pale tongue. It won't be a red tongue because of a coldness. A thin white coating. Floating tight pulse, tight or floating tense pulse. That's due to coldness. The fixed bee. The fixed bee, the patient may present as numbness or heaviness sensation. So heaviness is very important for dampness. This is one of the most important characteristics of dampness. The heavy sensation or the sensation moving downwards, swelling of the joints. So from swelling, you already can see the actual fluid in specific area. Fixed location, the water so doesn't move. Because of the dampness, it can be aggregated on cloudy or raining weather. That's what I was talking previously. The patient may present as similar to the weather forecast. The pain will be worse a few days before the weather changes, a few days before the cloudy or raining day. White greasy coating, that's because of the dampness. It's an impathogen. Slow or surgy pulse, that's also dampness. 热 bee, heat bee. You don't need to write about the term in the brackets. These are the Mandarin term. It means exactly the same. Heat bee. Due to heat, it can be one or multiple joints. Sorry, this is joints. The patient will present as redness, that's due to heat. Swelling, extreme pain with limitation of movements. The pain will be relieved by coldness. The patient may present as fever, thirst, or yellow greasy coating. Slippery, rapid floating pulse. So these are all indicated the heat. So the heat bee and the painful bee. The painful bee can be relieved by the warmth. The heat bee can be relieved by the coldness. You also can see from the tongue. The tongue will be yellow coating, red tongue, yellow coating. No matter what type of bee pain syndrome, we're going to focus on relieving the pain because the patient feel pain. So you have to relieve the pain if you can. You also need to unblock the qi and blood circulation. So because these are the pathogenesis of tumors, we'll focus on the obstruction of qi and blood. And then you're going to focus on which cause the wind, the heat, or the dampness. You're going to select different points. Many focus on local points and additional points according to the meridian differentiation. The meridian differentiation we didn't introduce in detail. It is the self-study. The main points are Shi points and local points. The Shi points is very similar to the trigger points that we have introduced at the beginning of the myofascial pain syndrome. You're going to focus on the local points, and then for wandering bee, you're going to add bladder 17, spleen 10. Spleen 10, 血海. Why we need to add the bladder 17 and spleen 10? In the previous video, we introduced from 一中必毒, that's for treating the wind. We need to treat the blood. So, 膈腧, bladder 17, is the meeting points of the blood. It's also a special point. Spleen 10, 血海, 血 is the blood, 海 is the sea. So from the name, it means the sea of the blood. The painful bee. The painful bee is due to coldness. So we will add bladder 23, 人 4. We also can use Moxibustion. Bladder 23 is the point for kidney, 肾腧. Kidney is where the original yin and yang comes from. So we can strengthen the bladder 23. You can use either Moxibustion or reinforcing technique. Fixed B is due to dampness. You're going to use the Usher points and local points. Then you plus spleen 9, stomach 36. Stomach 36 strengthen the stomach and spleen, can help you to clear the dampness. Spleen meridian also can help you to clear the dampness. The heat, due to heat, you're going to use do 14, large intestine 11. You can use reducing technique. Do 14, you can use reducing technique. You also can use the technique to prick for bleeding, prick to cause bleeding. And afterwards, you even can put a cup on top of do 14 to cause more bleeding to reduce the heat. So the local points for shoulder, you can use. So I'm not going to go through in details. These are just the references that you can think about. Needle technique. Normally we use 54 needles. We reducing or even manipulate technique. For cold, you can use Moxibustion. For heat, you have to use reducing or prick to bleed. Apart from the feeding foam needling technique, we also can use skin needling technique followed by the cupping. The electrical stimulation also can apply with the feeding foam needles. So firstly, you're going to insert the needle, you're going to achieve the qi sensation, and then you're going to connect the cable. You're going to use the electrical stimulation for 10 to 20 minutes. The qi arrival is very important. You need to insert the needle and manipulate until qi arrival. Then you're going to connect the electrical stimulator. According to the meridian differentiation, there are different approaches that you can select the points. For example, from the classic Sometimes we can treat the left side from the right side. We can treat the right side to the left side. We can treat the upper body from the lower part of the body. We can treat the lower part of the body to the upper part. For example, the pain in the left shoulder, especially forearm shoulder, the pain in the shoulder, the limitation of the shoulder, we can use the points on the leg. We're going to select the points according to the names of the meridian. If hand tie in meridian, so in order to differentiate this meridian, you need to know where does the hand tie in meridian flows. The hand tie in meridian you can use on the right side of the spinning 9 to GB34 on the points of the foot tie in meridian. The left shoulder on the hand Yangmi meridian, you can use stem 38, full bladder 57 on the right side. So opposite side, in the Taiyang meridian, you can use bladder 58 to spleen 7. And also from the treatments, from acupuncture treatments, the management from the lifestyle is also very important. So we also need to advise the patient how to avoid or how to maintain the health. So we need to tell them that to avoid the wind, coldness or dampness, especially the environment. For instance, the weather we cannot change, but sometimes the patient will stay in a room with the air condition, very cold air condition. So that's the coldness that they can avoid, or keep warm, to dress warm. This can help them to maintain and or avoid the recurrence of the diseases. Also, when we see a patient with different kinds of pain, it is very important to differentiate from bone cancer or bone TB. The patient also may present as pain. We can use acupuncture in this situation to relieve the pain, but in the meantime, you need to advise the patient to have a further diagnosis or further treatments with other treatments or with with conventional medicine treatments. So that's very important. Don't tell the patient that acupuncture can relieve the pain. It can relieve it quite well, and after a few years, all of a sudden, the patient come back to you says that I got bone cancer and has spread all over. So the prevention is very important. Early diagnosis also very important. How do you know the bone cancer? You can see from the blood test. Also, the observation is very important. Patients suffer from cancer, their facial complexion will change. Also, the pain is extremely painful. Image from the conventional medicine is also very important. Bone TB, the patient may present as low-grade fever or tidal fever, sweating. These are some symptoms of TB, so you need to exclude these diseases. Neuralgia paresthetica. It's a condition that's due to the lateral femoral cutaneous nerve, LFCN. The compression of these nerves, and then the patient results in aching or burning sensation or numbness. This disease has been described in 针灸甲乙经. So in the study, I have asked you to focus on 针灸甲乙经. This book has recorded this kind of symptom. The patient will present as numbness. The etiology for this problem is very similar to the B syndrome. That's why we put it as an appendix of B syndrome, due to the wind, the coldness, dampness, and results in the obstruction. The common causes may be overweight, pregnancy, injury, oppression, or pressure results in nerve damage. The treatment principles are very similar to the B-pain syndrome, activating qi and blood circulation unblock the meridians. The points we are going to use is also the local points, as well as the points on the foot Shaoyang meridian, as well as some points on the foot stomach meridian, foot Yangmi meridian, such as GB31, GB30, stomach 32, spleen 10, 80 points. You also can add some points at the low back if it's due to the cause is from the low back, or if some patient presents as some sensitive area at the lower back. So while you press, the patient may feel worse, or the patient may feel sore when you press at the lower back. Now you can add 腰夹脊, the 华佗夹脊 points of the lumbar region. You also can use the bladder meridian at the points on the bladder meridian of the lumbar region. Mostly we use Philipson needles with reducing or even manipulation technique. As you can see here, for pen, for different kinds of pen, mostly we will use reducing manipulation technique. We also can use Moxibustion if due to coldness or dampness. Electrical stimulation, you always can plus on the Philipson needles. The 3-edge needling technique plus cupping to cause bleeding can be used for chronic condition. The reason is because the chronic condition will result in blood stasis, so we can cause bleeding to increase the new blood to come to fix the area, to cause bleeding, especially when the patient presents as numbness. The lower back pain is one of the most common diseases that we see in an acupuncture practice. The main presentation will be the patient presents as the pain in the lumbar region. The lower back pain mostly refers to the chronic condition. If in acute onset, the patient may have a history of injury, and then we will put them in the category of the acute waist strain. So the lower back pain may relate to the damages or the tissue, the muscle, the soft tissue, the ligament and bones and joints of the lumbar region. The common medical conditions are the soft tissue injury, diseases that are related to the vertebra in the lumbar region. The etiology still is similar, exogenous factors, can be trauma, also can be overwork. Exogenous factors attack the wind and coldness, still similar to the B-pain syndrome, humid, dampness, trauma, direct damage, external force. It can be bending, prolonged bending, or heavy lifting, overwork, the weak body constitution, senior age, excessive sexual life. So these will result in a kidney deficiency. One of the most common manifestations of kidney deficiency is the lower back pain and the soreness in the lower back and the knees. So all these factors may result in qi and blood circulation, obstruction of qi and blood circulation in the lower back. The main symptoms of the lower back pain is the pain in the lumbar region. It can be on either side of the vertebra. It also can be on the center. So mostly related to the bladder meridian and the dual meridian. So from the treatment, we can focus on the points on the bladder meridian. We also can focus on the dual meridian. In the meantime, we also can use the distal points, such as bladder 40, for the lower back pain. We also need to consider the causes, such as the kidney deficiency. We also need to use such as kidney 3, the kidney 3 to tonify the kidney. So these are something you can think about. But in the meantime, although acupuncture is very effective for lower back pain to relieve the pain, but in the meantime, we also need to be careful some medical conditions, especially if the patient if you don't see improvements, if you don't see any improvements after a few sessions, you need to consider other medical conditions. So there are some examinations that you need to consider, such as the X-ray, CT, or MRI. In some ladies, the gynecological inflammation also may result in lower back pain, so that's something you can consider. This was from a lady, 75 years old. I saw her last year, and this lady, she presents as sciatica. So she presents as a pain in the leg and the lower back. She got a history. She worked in a garden. She was lifting something. The pot also not too heavy. But after lifting the pot, she feel severe pain at the beginning. But when she come to me, she still feel pain, but not as severe. So advice to have the MRI check. At the beginning, she refused because the cost of MRI, because MRI is quite expensive. So she would like to have acupuncture for a few sessions first. So after a few sessions, I insisted that she must have the MRI done. And then that's the report, the image from the MRI. As you can see here, that's a compression fracture on T12. And after the fracture, something is protruding. So this region, that's where the pain comes from. This region is where the pain comes from. This is still not too bad, but especially from this spot. For this situation, acupuncture will never fix. So in this situation, if in a severe condition, the patient must go through the surgery. If the patient doesn't present that much symptom, the patient must rest, not come to you for the acupuncture treatments, comes and goes. The patient must rest. Ideally, she must do the surgery to support this vertebra. So the examinations are very important to have a fault-free practice or to ensure your safe practice. Otherwise, this kind of patient, if you convince the patient that acupuncture can work, after a few sessions or after even 1 or 2 months, the patient still experience severe pain, it might be worse because the weight of the body will keep compressing this vertebra. If it's misdiagnosis, also you delay the treatment. So that's very important to have the examination done. The cold dampness, blood kidney deficiency. The cold dampness, the patient will present as soreness, pain. But why it's cold dampness? It's because this pain will be worse in a humid or rainy weather. Heavy sensation. You see, all these manifestations are the characteristics of coldness and dampness. That's also why I emphasize the study of the basic theory. If you understand the basic theory, it will be very easy for you now, because once you see the cold dampness, then you can understand the symptoms directly. When you see the coldness, you know that the tongue will be pale. The dampness, it can be greasy coating or slippery coating. Salty pulse, also dampness. Slow pulse, coldness. Blastasis, a fixed pain, stabbing pain, is all from the basic theory and diagnostics. Blastasis, the patient may present as purple tongue, choppy pulse. Kidney deficiency, bowel pain. So for kidney deficiency, this is a deficiency syndrome. A deficiency syndrome, the patient won't feel severe pain. That's why it's dull. The pain is dull. It can be relieved by pressure or rubbing. Pressure by pressing or because it's deficiency, so for deficiency, the patient will prefer pressure. For excess, the patient will dislike pressure. So for parastasis, the patient won't feel better after pressing. But for deficiency, the patient may present better after pressing. Because of the kidney deficiency, the patient may present some other symptoms that's related to the male's problem or female's problem. Deficiency, fatigue, pale tongue with deep, weak pulse. The treatment principles: 1. The meridian, dispelling coldness and dampness. So it depends on the causes. Stagnation, you're going to remove the stagnant blood, or you're going to tonify the kidney. The main points, you can use the local points, bladder 23, do 6, do 3, bladder 25. These are all local points. For cold dampness, you can add do 2. For blood stasis, bladder 17. We have explained previously why you use bladder 17. Bladder 17 is a very important point for activating the blood circulation. Kidney deficiency, you can use do 4. You can use Moxibustion with foods, can enhance the warming function of the Moxibustion. We will use the combination of acupuncture and Moxibustion, reducing method because of the pain. But this is enough for the kidney deficiency. For kidney deficiency, we can use reinforcing. The skin needle and cupping you can use for blood stasis. You also can apply the electrical stimulation. In this video, we mainly discuss the B pain syndrome as well as the lower back pain. Thank you for your attention.